Good morning, everyone. Today, our topic is Introduction to Marketing Sexual and Reproductive Health, SRH Services. While many think of marketing as simply advertising products, in the context of SRH, it is a far more complex discipline. It involves understanding human behavior, navigating deep-seated cultural norms, and managing the delicate delivery of services that are essential to human dignity. We will explore what these services are, the unique barriers they face, and how we can effectively manage and market them to improve public health outcomes. Let's establish our foundation by defining what we actually mean by SRH services. First, the definition. SRH is not merely the absence of disease. It refers to a state of total physical, emotional, mental, and social well-being. For example, treating an infection is clinical, but ensuring a patient feels no shame, emotional, and has a supportive partner, social, is true SRH care. Second, these services must include bodily integrity, informed choice, and freedom from coercion. A practical example here is contraceptive counseling. A provider must never pressure a woman into a specific method, like sterilization, but rather empower her to choose what fits her lifestyle. Third, the life course approach. SRH isn't just for young adults. It covers the entire lifespan, from adolescence, puberty education, through the reproductive years, pregnancy and family planning, all the way to menopause and post-reproductive stages, managing hormonal changes and screening for reproductive cancers. So, what are the clinical pillars of these services? We can break them down into 7 primary components on this slide. Family planning and contraception. This is the bedrock of autonomy, allowing individuals to decide if and when to have children. Fertility care and infertility management. Often overlooked, this supports those struggling to conceive, addressing the medical and psychological toll of infertility. Maternal and newborn health. This covers the critical window of pregnancy, delivery, and the postpartum period to ensure survival and health for both mother and child. STI prevention, testing, and treatment. This involves managing infections like chlamydia or gonorrhea, which can have long-term fertility consequences if untreated. HIV prevention and care. This has evolved significantly. Modern services now include PrEP, preventative medication, alongside traditional treatment for those living with HIV. Gynecological cancer screening. This focuses on early detection, specifically vaccination against HPV to prevent cervical cancer, as well as breast cancer screenings. Safe abortion and post-abortion care. Where legal, this ensures safe procedures. Regardless of legality, it always includes treating complications from unsafe procedures to save lives. Moving forward, we see 2 additional components that support the clinical pillars. 8. Sexual health counseling and sexuality education. This moves beyond biology. It involves comprehensive sexuality education, CSE, that teaches young people about consent, healthy relationships, and decision-making skills, rather than just the plumbing of reproduction. And 9. Gender-based violence prevention and support. Health clinics are often the first contact point for survivors of domestic or sexual violence. Services here include trauma-informed care, evidence collection, rape kits, and referrals to legal or shelter support systems. Despite the necessity of these services, access is far from universal. We face 6 major barriers. Stigma. Societies often judge sexual activity, especially among adolescents or LGBTQ+ individuals. For instance, a teenager might avoid buying condoms because they fear the cashier will judge them. Cultural norms. In some cultures, women have restricted mobility or lack decision-making power. A woman may want health care, but is not permitted to leave her home without a male guardian. Legal restrictions. Laws vary wildly. Parental consent laws might prevent a 17-year-old from accessing contraception, or restrictive abortion laws may force patients to travel great distances. cost and supply. Even if a patient wants care, they may face stockouts, where the clinic has no medicine, or high out-of-pocket costs that insurance doesn't cover. Provider bias. Sometimes the barrier is the doctor. A provider might refuse to offer a long-acting contraceptive to a young, childless woman based on their own belief that she might regret it later, violating her autonomy. Digital divides. As we move to telehealth, we leave behind those without smartphones or reliable internet, creating a new form of inequality in accessing information. To counter those barriers, we manage our services based on these 6 guiding principles. Rights-based. We view health as a human right. This means emphasizing autonomy and confidentiality. No one should be treated without their explicit consent. Client-centered. We design the system for the patient, not the doctor. For example, opening clinics on weekends so working women can attend without losing wages. Evidence-based. Protocols must be based on current medical science, not tradition or myths. Equitable. Services must be accessible to everyone, regardless of their gender, how much money they make, or if they live in a rural village versus a city. Integrated. This is the one-stop shop model. If a woman comes in for baby vaccinations, we should also offer her family planning and nutrition advice in the same visit. And non-stigmatizing. The environment must be judgment-free. Staff are trained to treat every client with dignity, ensuring no discrimination based on lifestyle or identity. The landscape of SRH is shifting. Here are the current trends reshaping the market. Expansion of telehealth. We are seeing a boom in online prescription services where patients can get birth control pills mailed to them after a video consult. Rising digital platforms. Self-care is growing. People are using apps to track fertility or self-injectable contraceptives like DMPA-SC that reduce the need for clinic visits. Policy polarization. Unfortunately, political climates are affecting access. Changes in government funding or legislation can suddenly restrict or expand what services are available in a region. Person-centered shifts. We are moving away from a purely medical model to a holistic one that considers the patient's emotional and social life. Male engagement. There is a growing push to include men and boys, both as clients, for example, for vasectomies, and as supportive partners in reproductive health. Post-pandemic resilience. COVID-19 taught us the fragility of supply chains. There is now a renewed focus on ensuring supply chains are robust enough to withstand global shocks. When marketing these services, we must recognize their unique characteristics. High sensitivity. These topics are deeply personal. They tie into a person's morality and identity. You cannot market an STI test the same way you market a dental checkup. Stigma. Diseases like HIV or issues like infertility carry heavy social shame. Marketing must normalize these issues to reduce fear. Privacy and confidentiality. This is the currency of trust. One breach of privacy, like a clinic calling a patient's home and revealing test results to a family member, can destroy a clinic's reputation instantly. Power dynamics. We must acknowledge that gender norms and age hierarchies affect who gets care. A young wife may not have the power in her relationship to demand condom use. Legal and ethical constraints. Unlike other businesses, marketers here cannot be neutral. If a service is illegal or politically contested, the marketing strategy has to navigate that legal minefield carefully. So, what is marketing in this context? The definition. It is the process of creating and exchanging value. We aren't just selling a pill, we're offering peace of mind, health, and future stability. The application. We use commercial marketing tools, like market segmentation and branding, to help providers identify what their patients actually need. For example, branding a clinic as youth-friendly signals safety to a specific demographic. The goal. It's a dual goal. We want to satisfy the needs of the target market, the patients, while also achieving the organization's goals, public health improvement and sustainability. The scope of our marketing efforts is broad and strategic. Creating awareness, we must ensure people know what services exist. For example, running a radio campaign to inform men that vasectomies are available and safe. Increasing access. Marketing identifies barriers. If we find people aren't coming because of transport costs, we might market a mobile clinic solution to address that logistical barrier. Building trust. Because these topics are personal, we must build trust in high-context domains. This might involve using respected community leaders to endorse a vaccination campaign. Positioning within public health. We frame SRH as part of the bigger picture, linking it to autonomy, equity, and disease prevention. Communicating evidence-based info. In an era of fake news, a huge part of the scope is combating misinformation, such as debunking myths that birth control causes infertility. What does a marketer actually do day-to-day in this field? Detect shifts. They analyze data to see changing trends, like a sudden drop in condom usage among teenagers, signaling a need for a new intervention. Segment audiences. They don't treat the public as one block. They create different strategies for adolescents, unmarried adults, migrant populations, and men. Tailor messaging. They ensure communication is culturally competent. The language used for a conservative religious community will differ from that used in a secular university town. Translate clinical services. They turn complex medical jargon into value propositions. Instead of explaining the chemical composition of an implant, they market it as 3 years of worry-free protection. Build partnerships. They extend reach by partnering with schools, community groups, or digital influencers. Monitor misinformation. They actively watch social media to identify and counter harmful health rumors with evidence-driven campaigns. Uphold ethics. They ensure that in the drive to get numbers, the organization never exploits patients or uses sensationalism. Now, let's look at specific market shifts, starting with fertility care. Rising demand. There is a demographic shift where people are delaying having children to focus on careers. This biologically increases the difficulty of conception later, driving up the demand for fertility services. Consumerization of IVF. In vitro fertilization, or IVF, and egg freezing are becoming consumer products. We see egg freezing being marketed to young professionals as a form of fertility insurance. Inequities persist, however. The market is skewed. High costs create a disparity where only the wealthy can access these technologies, while racial minorities often face lower quality care or bias in diagnosis. Next, looking at contraception. Expansion of LARCs. There is a strong market shift toward long-acting reversible contraceptives, like IUDs and implants, because they remove the user error of remembering a daily pill. Digital counseling. The place of marketing has moved online. Teleprescribing allows users to bypass the clinic waiting room entirely. User preferences and misinformation. Patients are increasingly worried about side effects, often driven by anecdotes on social media like TikTok. Marketers have to work harder to provide scientific reassurance. Policy fluctuations. In many regions, access to contraception is becoming politically linked to abortion restrictions, reshaping both access and demand. Finally, in maternal health services, focus on quality and respect. There is a movement against obstetric violence. The market is demanding respectful maternity care where mothers are listened to, not just treated as vessels. Rising maternal mortality. Alarmingly, in some high-income settings, maternal death rates are rising, particularly among marginalized groups, for example, Black women in the US. This is forcing a market reevaluation of how we support at-risk populations. Integration of digital tools. We are seeing the rise of remote monitoring, using wearable devices to track a pregnant woman's blood pressure from home. male/partner engagement. Finally, the market is recognizing the family unit. Services are increasingly designed to include partners in prenatal visits and parenting classes, moving toward a whole family approach. That concludes our detailed walkthrough of the marketing and management landscape for reproductive health services. Thank you.